My name is Dr.Tsai, and I'm a board-certified plastic surgeon in Beverly Hills, California. I've been in this field for almost 10 years. The amazing thing is to see how beauty trends change significantly. When I first came out, for example, large breasts and big butts were in. Nowadays, it's more about the natural look, so smaller butts, natural appearance, smaller breasts, and more the athletic look is in. So beauty is a subjective measure, and it's also to the eye of the beholder. Nowadays, beauty is going more towards a diverse expression of beauty and individuality versus a one-size-fits-all standard of beauty, which I feel is amazing. So it's even more imperative and important to understand where the patient's goals and desires are in order to produce and perform the surgery that's correct and that will give them the results that they desire. Additionally, as I mentioned, the trend is now going towards a more softer, natural look and appearance. So it's important to listen to the patients, to adhere to what their wishes are, and not put your own beauty biases into the procedure and the surgery itself. As time progresses, medical technology and treatments advance very, very quickly. For example, so during training, we were trained to do a nose in what we call an open rhinoplasty. Nowadays, I do something called a closed rhinoplasty, which is almost a scarless rhinoplasty. The scarless rhinoplasty approach decreases swelling, improves healing time, and creates less scarring. This is something I learned after my training, and that's an advancement that I feel has been significant in my practice, as now rhinoplasties are my #1 procedure by volume. A lot of patients are seeking this type of technique. Additionally, when it comes to rhinoplasties, a new device called Physio allows dissection of the tissues, which also decreases swelling and bruising. In addition, some advances in body contouring is something called Vaser, where it helps break up some of the fatty tissues and allows the surgeon to remove more fat. More recently, the advent of radiofrequency and microneedling procedures has improved and significantly expanded the non-invasive market for skin tightening, which before that, the only treatment would be a surgical procedure.
Everything's been great. Everything went good as planned, and he's very supportive. And if you had any questions, anything like that, you can always reach out to him on a personal number, and he's always there to answer any kind of questions. I was nervous a little bit, of course, but he was very supportive, very ensuring and things like that, and made me feel comfortable about making the decision that I made.
Hey Mike, how are you?
Good, good.
All right, how you doing today?
Doing good, thank you for asking.
Great, great. All right, so we're about a month from surgery today now, correct?
Yes.
All right, cool, cool. How do you feel?
I feel good.
You feel good? Recovery's been fairly smooth?
Yes.
Okay, no real major issues, pain, or anything like that?
Everything's been good.
Great, great.
Yeah.
Are you back to doing most, if not all, of your normal daily routine and activities?
Yeah, I'm back at the gym and things like that.
Oh,
good.
Amazing. So you're healing a little bit quicker than most patients.
Yeah.
Great. So now that we're at a month, I have all my patients go back to basically everything they're doing before. Okay. So you can start working out even a little bit heavier if you would like. Okay. You can start soaking, so hot tub, pool, jacuzzis, you're more than welcome to do. If you want to go in the ocean, you're fine. Whatever activities you were doing before, you're more than welcome to resume.
Perfect.
So 100% of everything you're doing before.
Perfect, sounds good.
Okay. Great, so if everything's good, then I do want to see you in about 2 or 3 months from now, just to check in with you, make sure everything's good, and kind of take it from there.
Perfect.
All right, sounds like you're healing and everything's going very well, so let's see you in about 2 or 3 months.
Perfect,
all right?
good. Thank you.
Of course, very good to see you, take care.
Thank you.
I'm 100% satisfied and happy. Definitely recommend it, highly recommend Dr. Tsai.
So my interest in the medical field started when I was a kid. My mom is a pharmacist and she works at the hospitals, and during the summertime or when there wasn't much to do, I would go and watch her and go to work with her and experience the hospital work and life, and that got me very interested in medicine. I then decided to go to medical school, and my initial thought was to become a pediatrician because I love working with kids. During medical school, we do rotations in every major subspecialty within medicine. And although I still enjoyed pediatrics, I felt a pull towards surgery. As a youth, I was always into everything. I played tennis, baseball, basketball, swimming. I was actually on the swim team and the tennis team. I played a lot of musical instruments, saxophone, violin, piano. So the variety of extracurricular activities was important to me. So when it came to surgery, I also wanted to do something that had a wide scope and range of procedures. When you do heart surgery, all you're doing is heart surgery every day. When you're doing brain surgery, you're just doing brain surgery every day. With what I do, I get to do surgery from head to toe. My number 1 procedure is rhinoplasties. My number 2 procedure is breast augmentations and breast revisions. And my number 3 procedures are mommy makeovers, liposuction, and body contouring. So I could literally be doing something different multiple times a day. So a rhinoplasty is basically a nose job. That's the basic term for it. A lot of patients ask for either straightening of the nose or removing the bump on the nose, thinning the bridge, thinning the tip. So a rhinoplasty is basically restructuring the nose to create a better contour for the patients. So oftentimes, plastic surgery, there's a very wide realm within plastic surgery. I specialize more in the cosmetic part of plastic surgery, but plastic surgery is also reconstructive surgery. And so oftentimes during our training, we fixed cleft lips and palates, for example. Oftentimes we helped burn victims and burn patients. We also do a lot of hand surgery. So patients who had mauled hands or mauled fingers or detached fingers, we fixed those. Another big aspect is breast cancer reconstruction, breast cancer surgery, which is the number 1 killer for women. And so, there's a lot of reconstructive aspect within plastic surgery that we are involved in as well. An important part of femininity and womanhood is breasts. And so not having breasts, oftentimes women don't feel whole. So being able to reconstruct and provide breast back to them allows us to bring them back to whole again. Oftentimes youth is correlated to vitality, health, and status. The most important thing about the psychology of plastic surgery is to understand that these procedures are to be done for yourself. Just because you get plastic surgery doesn't necessarily mean you're going to be happier or your life is going to be more fulfilling or more rewarding. It's important to be, again, happy with yourself. Again, plastic surgery can enhance things. They might give you more confidence. You might, be more open to doing certain things that you were afraid to maybe do before surgery. But how you perceive the world and how the world perceives you is going to be exactly the same.
So yeah, I met Dr. Tsai about a year ago in April of 2023. Within a month, I scheduled a consultation and was able to get my surgery scheduled for Memorial Day and got a breast augmentation, my first one. So I wanted to go a little bit bigger than I was originally hoping for, but I was really excited with the results. Dr. Tsai was very patient with me. He took his time and really explained kind of all of the benefits and also the risks and implications during and after surgery. So my recovery time was about 3-4 days after surgery. That's when I started getting up, going back to work. It's pretty quick for a surgery. I was really impressed. I didn't have too much pain. I was heavily medicated, but I was very comfortable. Saw Dr. Tsai a week after, and then I've been seeing him a month after for over a year. So feeling very comfortable with my results. Not too much. I was pretty comfortable with everything. He was really diligent about explaining to me who I was meeting day of surgery. And I was very confident that, even though I was going under, I was in the best care.
Hi, Juliana. How are you? How's everything? How you been?
Doing well.
Great.
Doing well. Just got back from Coachella.
Oh, nice. How was it?
Amazing.
Fun? All right, so we're about a year from surgery. That's great. Wow, we made it. A full year.
They made it.
They made it. How do you feel? Are we back to
I feel really good.
any issues or concerns for me?
Not really.
No?
Everything's pretty good.
Okay.
I'm still trying to figure out how to shave a little bit and kind of be am I gonna push them too much? But
Gotcha.
great.
No worries. So you're back to all your before activities, working out, exercising, swimming in the ocean, water, everything. Raving. Yeah, I had fun in Coachella.
Exactly.
Great. So nothing holding you back, back to life. They feel good.
Normal, yeah.
Any firmness, any hardness, anything to be aware of? No? Okay. Well, let's take a quick exam and see what we got here. Yeah. All right. Good. They feel nice and soft.
Yeah.
You're doing massages, right?
Yeah.
Great. All right. You can have a seat. So, if there's no issues, concerns, or questions, this is probably our last visit.
Last one.
Yeah. Everything looks good. They're soft. If there's any problems moving forward, definitely give us a call back at our office, but this is probably our last visit then.
Thank you so much, Dr. Tsai.
It's my pleasure. It's my pleasure. It's wonderful taking care of you.
Yes.
And if there's anything else you need, please let us know.
Next procedure is on the book.
Next
already.
procedure. Let me know. I'll be here. Okay.
Sounds good.
But yeah, give us a call if there's any concerns or questions as time progresses. The one thing to realize is, caps or contractures can potentially happen as time progresses. There's not like a rhyme or reason for it. And if there's any concerns with it, if you think that one of the implants might be bursted or anything like that, give us a call, come in, let me take a look, and we can take it from there, okay? It was wonderful to take care of you. If there's anything else you need, let us know, okay? Of course, my pleasure.
Bye, honey.
Of course, take care.
I would 100% recommend Dr. Tsai. I've already recommended him to my coworkers for not only breast augmentation, for rhinoplasty and other surgeries and performances, yeah.
Another important myth to debunk is once you have surgery, you're done forever. No, as I mentioned before, our body does continue to age. For example, let's say we got a facelift in our 40s. That doesn't mean by the time you're 60 or 70, you might not need another one because our face does continue to age. Although from your 40s to your 60s, you're gonna look amazing and you're gonna be looking like you're 20 years younger. But as time progresses, we all might need a little touch up here and there. So although surgery is permanent, it's also semi-permanent because of the effects of aging. Lastly, another important myth to talk about is, does breast implants cause issues with breastfeeding or breast cancer? So research has shown that breast implants do not affect breastfeeding, and breast implants do not affect breast cancer, whether it's the detection or the severity of the cancer. So you can perfectly have implants, perfectly breastfeed your baby, and have a healthy young baby. And your risk of breast cancer does not go up. So safety is always the number one important thing when it comes to cosmetic surgery and plastic surgery. This isn't a type of surgery that is needed to sustain your life. This isn't like a heart attack or a brain tumor that needs to be removed. This is just for pure appearance, vanity, and potentially confidence. So the surgery is done appropriately. The patients always get a medical clearance and labs to make sure that they are safe and are healthy enough to undergo general anesthesia and surgery. Additionally, it's important to make sure that patients' expectations are set. Oftentimes, patients come in with outrageous requests, and it's important to let them know, hey, there's only so much we can do. This is the human body. This isn't like sculpting or cutting wood or building a house. Our body reacts very differently to different stimuli. And so even during the healing processes, everybody can heal differently, even if you perform the same exact procedure. So it's important to set the expectations from the get-go. Absolutely, I turn patients away all the time. For me, it's important that I can produce the results that the patients desire and want. I want a happy patient. I don't want a patient who's not happy with my work and results, because my name is on that and my name is out there. So it's very imperative, at least to me, that I'm able to obtain the results and the desires of each single patient. So for example, I've had patients ask for outrageous procedures. One example that comes to mind is the largest implant that is made is 800 cc's. I can't tell you how many patients ask me for 1,000 cc implants or 1,200 cc implants. I mean, you can get that with saline implants if you overfill it, not with silicone, but you can definitely overfill with saline implants, and those patients I will not do and turn away. So the difference between saline and silicone is a gel. And the silicone is going to look, feel, and act and mimic more like breast tissue because it's a gel and it's made to look and feel like breast tissue. Now, a saline implant is basically a water balloon. It's filled with saline, which is water that you get through an IV. So you have a water balloon versus what we call nowadays a gummy bear implant. So the beauty trends have also changed over the past few years. The vast majority of patients, again, want a more softer, more natural look, feel, and appearance. That is going to be more of your silicone implants because that is made to mimic more of a breast tissue. Patients want more of that exotic look where it's fuller, higher, and rounder, and maybe even tighter. That's going to be more of a saline look and appearance. So with plastic surgery nowadays, medical advancement and technology has improved so significantly to the point where patients are healing very rapidly and it almost feels like they didn't really have surgery at all. For example, patients used to go to the hospital and stay overnight for these procedures. Nowadays, I have hardly anybody stay overnight at an overnight facility for surgery. I would say 99.9% of my patients go home right after surgery. The only patients that would warrant staying at an aftercare facility are those that are getting a 6 or 7 hour procedure, like a whole body makeover. Those patients, because they've been under anesthesia for a very long period of time, warrant more closer look and examination overnight. But most of the procedures that I do, breast augmentations or rhinoplasty, tummy tuck, breast lifts, they all go home the same day. So for smaller procedures like a breast augmentation or even a rhinoplasty, A lot of patients do their surgery on a Friday and they're back to work by Monday even. The technology has improved so much with pain medicine and care that patients feel a lot better after the first few days after recovery and surgery. The anesthetic has also gotten so much better that the brain fog is also gone much quicker. Most patients are back to work in their daily life and routine within about a week, and most patients are back to working out, lifting, and doing strenuous activities in about 1 month. Hi Isabel, how are you today?
Good, how are you?
I'm wonderful, thanks. We're interested in Botox today, correct?
Yes.
All right. Have you had Botox done before?
No.
All right, so it's your first time?
First time.
Great. So let's chat about it real quick.
Okay.
Botox is a muscle relaxer. So wherever we inject into, it will relax the muscles and prevent the lines and wrinkles from forming on the skin, okay? The most popular places are in between the eyebrows, up on the forehead, around the eyes, and even sometimes the masseters to help with crunching of the jaws and grinding. And those are the most popular spots. So Botox takes about 5 to 7 days to kick in. So you might notice some feeling of weakness in about 3 or 4 days, but it does take about 5 to 7 days to fully kick in. And the Botox will last you about 3 to 4 months, okay? All right, so let's do it.
Let's do it. I was a little nervous at first, but thankfully Dr. Tsai is a natural and he made it a completely painless process. I mean, getting a flu shot hurt more than getting Botox, so it really was so much easier than I thought it would be. Dr. Tsai has a great bedside manner. He really is good with connecting with his patients, making sure that any question that you do have is answered thoroughly.
All right, so give me an angry look down. Good, relax.
He gives everything with detail, especially when you're new to a procedure such as Botox. I'm worried, it's going in my face, so I'd like to know the entire process. And he's made everything incredibly smooth, seamless, and painless. And it's been 5 minutes since the Botox injections, and I think the swelling has gone down. I don't have to worry about anything, any downtime. I can carry on for the rest of my day with the rest of my meetings without an issue.
All right, well the bumps will go away in about 10 or 15 minutes.
Okay, great.
And then you can put makeup on and go about your day.
Amazing.
Okay.
Thank you, Doctor.
My pleasure. All right, good to see you.
Good to see you.
All right, so we just finished that Botox procedure. Botox is the #1 procedure performed worldwide, volume-wise. And as you can see, it takes about 5 or 10 minutes to do. So you can even get this done during your lunchtime in the middle of the day. And after that, you can go back to life and work without any downtime. This is one of the many procedures that we perform here.
I would definitely recommend Dr. Tsai to all my friends, clients. I mean, we're in LA, everybody's always inquiring about Botox, so I would definitely recommend Dr. Tsai as their go-to.
So the most important thing here is to listen to patients. With beauty trends moving more towards an individualized expression of beauty and not a standard cookie cutter appearance, it's important to listen to the patients. Some patients want more of an exaggerated result. Some patients want more of a natural result. So it's important and imperative to put yourself in the patient's shoes and see and listen to what they want and their desires. Oftentimes, a lot of doctors don't listen to their patients and put their own beauty thoughts and desires into their patients. And I see this all the time because patients come to me for revisional surgery and they tell me that, oh, my doctor put implants that are way too big, I never asked for this, or my doctor did this and this, I never asked for that. So it's very imperative to listen to the patients, really listen to them, understand where they're coming from, and make sure that what you're doing will be able to achieve their goals and desires. For me, I feel like performing multiple procedures in one time will give the patients a multiplicative result. Not an additive, but a multiplicative result, because the patients can see the contouring from head to toe. And instead of having to come back for a breast procedure, then 6 months later come back for a body procedure, you get it all done in one sitting. There's one anesthesia, one recovery time, one surgical time, and again, your results are all done in one shot and you get to see it significantly better versus doing one at a time. Additionally, it's also cheaper for the patients because the patient's already asleep, and adding procedures on while the patient's already asleep is a lot easier to do than starting from scratch. I had a young patient that came and see me because she thought her nose is large, misshapen, and unattractive. She was often teased by her peers. She felt unattractive, not beautiful, was introverted, and felt terrible with her life. She had a beautiful soul, but nobody would ever know because she would be scared to go out in public. After giving her her nose of her dreams, she became more fearless, more energetic, more extroverted, and was able to travel and go out and not feel self-conscious about her nose. This totally changed her life and perspective. Her newfound radiating confidence is what makes my job very rewarding. Although not quite as life-changing, I have many patients come to see me for a breast augmentation procedure that are very flat, and their complaint is that they're not able to wear certain clothing, or they don't feel feminine or like a woman because they don't have a certain body look and appearance. Oftentimes these patients just want a very tiny augmentation, very soft, very natural, and just by doing that, by even placing just a small implant, very soft and natural, these patients feel more like a woman. And they feel more confident. They feel like they can wear certain clothing that they weren't able to wear before. They're able to go out and wear a bikini and not be petrified and scared that other people would make fun of them. But it can definitely improve our lives and make us feel more confident and make us feel better.
My name is Yessi Chavez. I got both my breast and my nose done. I was initially only coming in for my nose, but luckily I got convinced to do my breast, and it was probably the best decision I made.
Hi, Yesenia, how are you?
I'm good. How are you, doctor?
I'm wonderful, thanks. So we're at 1 week now.
Yes.
Okay.
I've been anticipating this day.
Great. We're here for the big reveal?
Yes.
Are you ready to do this?
Yes.
All right, let's take care of it for you.
No, I didn't know I could get my nose and my breast done at the same time. It only took a couple hours, so that was fantastic. I didn't have to do surgery twice. Yes, super nervous. I was actually planning to do it in June, but they had some availability, and I said, why not before the summer? So I thought it was perfect timing. The communication was actually really great. If I wasn't talking to Dr. Tsai, I was talking to his assistant, which is really cool because she's around my age, so it made everything a little more simpler and just easy to talk to. Yes, step by step of how I'm gonna feel, how long I'm gonna feel, and just kind of the longevity of the whole time it's actually gonna take to heal. So yes, Dr. Tsai was amazing. He walked me step by step of kind of the months of how it's going to go down, and I'm excited for the final results. The surgery was done about 9 days ago. So the recovery process was rough for the first couple days, but now it's been 9 days and I'm back to my regular routine. I go back to work and walk my dogs, so that's kind of all I need.
Ready to take a look?
Ready.
All right, here you go.
Oh my goodness, I'm a whole new person. It's getting some used to, but I love it. Yes, wow.
Good. All right, so you can see the major changes that we sought out to do.
Yeah.
As you can see, the bridge is a lot thinner. The tip is also thinner and elevated. And then the bump on the bridge is gone as well. So we got a nice soft slope there. Bump's totally gone. Nice little curve. I know everything's just a little bit exaggerated and a little funny looking. You're still a little bit bruised and swollen. But it will take about a solid month, as we mentioned before, to be presentable, and go out in public, start going to events and things like that. So it'll take a couple of weeks, but you can see the major changes and have a good idea of what it's going to look like.
Add some makeup and I think I'm ready to go, doctor.
Absolutely.
Yes, Dr. Tsai was really great at making me feel calm before my procedure. It was my first surgery, and he took it step by step and really made me feel at ease. I would definitely recommend Dr. Tsai. I was actually a recommendation from a previous patient, so yes, most definitely.
So everybody's journey is going to be different. The most important thing is to be happy with ourselves and who we are as a person. So plastic surgery can enhance our lives, it can bring us confidence and make us feel really good on the inside. And it's important to feel really good on the inside because when you feel good and beautiful on the inside, that radiates into our outer world, whether it's our job or our relationships. It affects all aspects of our lives. So plastic surgery isn't just for women. As you can see today, we also have male patients that do plastic surgery. So our male patient today, he came in for his follow-up, very happy with everything. As you can see, he feels a lot more confident and ready to live life to the fullest. Another one of my patients today was a breast augmentation follow-up from 1 year ago. As you can see from her results, she's got very soft, very natural looking appearing breasts to the point where you can't even tell she had them done. She's very happy with the results, which makes me very happy and what makes my job very rewarding. So we had another patient come in today for a Botox procedure. As you can see, it's performed very, very quick. Botox is a muscle relaxer, so it prevents the signs of aging. It can be done in 5 to 10 minutes, it can be done on your lunch break, and you can go right back to work in your life without any downtime. So we had a rhinoplasty nose job reveal today. She had this procedure done 1 week ago, and today was her reveal. She was very happy with her look and appearance. Although it's still fresh from surgery, she doesn't look exactly quite the part, but I look forward to following up with her and seeing how everything settles. Additionally, she also had a breast augmentation procedure, so she's one of those patients that had a combo dual procedure done at the same time.